Good morning, everyone, and thank you for joining the webinar. I'm a director in WSP's investment services team responsible for asset management and PFI handback. I've spent most of my working life in PFI, working on my first deal in 1998 when I worked in the public sector. It's now 23 years on, and I'm involved still in PFI, but now in the preparation and planning to hand back these projects. This is an exciting opportunity, a significant programme of change for the public sector. So for those of you not involved in PFI, please bear with me for the next 15 minutes. If we look at WSP's credentials in PFI, we have worked on over 700 PPP transactions. We provide a range of services from independent tester to facilities management. Most recently, we are acting as the technical advisor to the IPA on handback and operational reviews, and we're also helping in the IPA's technical guidance. We've also worked on Highways England as the technical advisor on handback. Andrew, if you could move to the next slide, please. So in terms of what is handback, it's the PFI concession that ends. Most projects are about 25 to 30 years, and we see the transfer of the PFI assets. It's not just the buildings, it's the infrastructure, information systems, and the services transferring back to the public sector. There are a few exceptions though, and it's important to understand the structure of the lease. Some leases will require residual valuation payment to go back to the SPV. This is not likely in healthcare, but it is important that the lease structure of the project is reviewed well in advance of handback. Handback also gives an opportunity for change, and it is recommended that the handback strategy includes for change management as well as managing the risk and the transfer of liabilities. The contract mechanism in your project agreement will have clear handback obligations, and these are generally around the handback condition and the residual life obligations. And it is important that at handback the quality of the assets are transferred across to the quality that is defined in the project agreement. Next slide. So in terms of why is handback important, it's a huge programme. It's going to have significant implications for the trusts and the public sector, but it is an opportunity for change. So if planning for handback is undertaken well in advance of the expiry dates, then you will find you will achieve value for money. You hopefully will ensure that liabilities do not transfer across and that you get the quality of the building and the infrastructure. It's also important to look at future proofing. Later you will hear about the net zero carbon, and rather than wait until the expiry of the PFI, it is important that you engage with the SPV and look at the annual and 5-year maintenance programmes that are currently being agreed to see what work needs to be done in order to achieve any new legislative requirements. There's also a need to manage your risks and manage your liabilities, and we'll go through the steps on the next couple of slides, as well as planning for handback, which is a significant project in itself. There is the need to ensure business as usual, to ensure your reputational risk and the services continue, especially near the expiry of the PFI. You want to make sure that if you're going to retain your site-based services staff, that you have that good engagement and communication. And the next steps is to ensure extensive planning. Next slide, sorry, Andrew. In terms of the consideration points, we need to look at the resourcing. There is a need, and the guidance is advising that you should be setting up your own project team specifically for handback, identifying your advisors, which will be a mixture of commercial, technical and legal. At the same time, you need to make sure that your business as usual, your day-to-day management team are, whilst they're involved in the process, that they do have like sufficient time to support the expiry as well as do the day-to-day management. The handback criteria, it is important that the contract will set out usually the condition requirements and or the residual life, and it will also agree the process. So it is important to map the processes out so you understand if there are any gaps in the information, and then seek the guidance and negotiation with the SPV. There's a number of risks and specific risks around handback, largely around the estate and the social infrastructure, and also how you're going to plan your services going forward. Estate strategy, in terms of when these buildings hand back, you will have, in terms of freedom of choice, how you use them. You will have, obviously, the costs that will need to be maintained, but it is important to start considering how you plan to use the facilities, your long-term aspirations, and where possible, start to build that in to the planning for expiry. We also recommend that it's a collaborative approach, relationships with the SPV and the FM contractor as the contract comes to the end. It's important that you enter into dialogue. There is a need to negotiate. There will be not necessarily conflicts, but there will be different objectives, and it's key to get those and identify and agree the way forward. Change management, again, that should be running alongside the expiry strategy so that people feel engaged and they do not, they don't have the fear that they may be losing their jobs as the project enter the expiry period. Third party use, a number of hospitals will have shops, cafes, and these will be under a license with the project company. The revenue is generally passed to the SPV. There might be a sharing with the trust, and it's important then, if you want to continue that use, that you enter into dialogue with the third-party users, and you'll need to then transfer any licenses or leases they have across to the public sector. And again, you will have a significant amount of data that will, 25 to 30 years worth of asset data and systems will need to be transferred to the trust. And then how do you ensure that your buildings are of the quality standard and the residual life that is required under contract? If we touch on the next slide, Andrew, please. So the contracts will have a requirement for certain surveys and condition inspections to be undertaken. It will depend on the complexity of the site and the project and what's included. Most trusts PFI projects will have FF&E and medical equipment. Some have data. So it's important to understand what is transferring across and have a team sufficient to be able to support that. You need to then consider when those surveys are best to be carried out. The contracts generally may require one around 2 years for a final survey. We consider that's too late, especially because you've got to plan the works in. So we would suggest that work start much earlier. And as well as the final survey, you take advantage of the condition surveys and the annual and 5-year maintenance plan. The final step being whether you need to agree whether you have a joint or an individual survey. If you have a joint survey, then you just need to make sure there's a duty of care and a reliance for both parties. And then finally, the programme of works from those surveys and the final survey, assessment of what works need to be done to achieve the condition, outputs and the residual life. So that will need quite extensive work. You then establish the value, what the value of works is needed to bring the estate up to the handback criteria. That, if as you can see, if it's left to the final stages, then access to to the healthcare facilities will be difficult. We know they're difficult now. You also have to consider obsolescence, like obsolete items, that what you don't want to be doing is transferring systems and finding that the manufacturers no longer supply the kit to maintain. So all of those items need to be considered as part of your handback strategy. And then finally, enhancements. There might be a need to, rather than place like for like, that you want some changes to fit your, say, net zero. There are also the scope to do trade-offs. If you want to change, or you have a plan to change areas in the future, then you might want more works in another area, and then you will derogate the handback condition for those areas that you don't want the works to undertake. So if we move to the next slide, Andrew. Thank you. So the suggested timeline. The first one being what we would suggest and heavily sort of recommend now is good contract management. If you start to work and ensure contract compliance, then what you're ensuring is that you're not leaving it to the end, and that you're getting the condition of the assets being maintained to the output spec now. It's also, there is a need to ensure compliance in the services, and to look at how you administer the payment mechanism. And then the next, sorry, Andrew, is year 7 to 10. I think most contracts have it, you know, sort of year 2 to 3. We would suggest that you start, depending on the complexity of your contract, but around between year 7 and 10 prior to expiry. And that would be where you start to map out the obligations, you set your handback strategy, and you commence the dialogue with Project Co. And in 5 years, thanks, Andrew, you start to then look at the implementation. So you need to have your project team and advisors established. You'd have your handover strategy being implemented. You had to have a detailed risk register. You'll have your condition surveys that have been taken place prior, and then you would look to agree the 5-year maintenance and lifecycle program that's already an existing requirement. And then as you move further towards handback year 2 to 3, then you start looking at your final condition survey. You need to agree the final program of works. They would be costed. You'd also need to look at the commencement for procurement of your services, enter into dialogue with your FM, or with Project Co and their FM contractor. You obviously, as the buildings transfer, you may wish to consider their maintenance subcontractors. If staff are transferring across to the trust, then you need to look at the TUPE transfer. You need to be auditing the systems and documentation that will be coming across to ensure sufficiency and how they will be integrated into the trust's current systems. And then also there is the provision in most contracts, you'll either have a handback bond that gives that added protection that then gets released once the handback criteria is met, or there are a number of contracts that allow you to keep a retention of some of the unitary charge. And then finally, you get to the final year where you actually see the mobilisation, the actual transition, systems transferring, and at some point there will be a need to confirm that the handback criteria has been met. So if we move on to the next slide, the main area here is to ensure early planning, and we do believe that will give successful outcomes. I mean, it's key that there's minimal disruption to the healthcare services. I mean, especially around the volume. If a lot of it is left to the very end, your options are limited. You will find access to areas will not be available. And so it is best to start that planning very early. You need to manage the risks. You want to make sure that liability for, you know, any upgrades don't get transferred across after handback, and that they are addressed. There's reputational risk to ensure that services continue. there's no legacy. You want to make sure that there are no legacy or residual risks after handover. So all of these need to be identified and negotiated, and ways to address them at the outset. You also, once you've got your the assets have transferred, you need to continue to look at obviously the asset maintenance and the replacement plans. So if you're planning early, you'll be able to build that into the handback strategy. There will be obviously the mobilisation and the integration of the new service provision and the TUPE transfer of some of the SPV FM staff. One of the areas to consider, if the estate is predominantly PFI, you may not have a large enough estates team to manage the new, the PFI estate being transferred back. So you may need to provide more central resource. And then in terms of getting value for money, I mean, there is a strong belief that if you ensure contract compliance now, that will assist towards the handback transfer process. I mean, there are also times when you may not be able to allow, especially because of clinical areas where access for works, and therefore there is the, negotiations around whether it's a settlement agreement rather than the works being undertaken. So finally, on the next slide, how can WSP help? Well, we have a team of around 60 involved in PFI and project finance transactions, covering commercial, technical and operational support. So we believe, a trusted technical commercial advisor, having obviously been doing the handback on Highways England, having extensive knowledge of PFI, and also now working with the IPA on their handback strategy. We have undertaken a number of compliance health checks where we do a deep dive. We've done a few for the IPA, but we've also done a number for public sector and private sector, where we look at compliance against the PFI output spec, and then we agree improvement plans. We can help you develop your handback strategy and to negotiate the joined up thinking with the SPV. We can undertake condition surveys and the final condition survey, or if we're advising the public sector, then we can help scope that, and we can help then agree the level of works required to achieve the handback requirements and certify that the handback conditions have been met. And then we can also audit the systems and data. I mean, there is a need, obviously, to ensure statutory compliance, both before PFI expiry and after. And we have systems and a toolkit that will allow to ensure that statutory compliance is adhered to. So I think that is the end of my presentation, Andrew. And I thank you all for taking part in the webinar.